Good morning. This is the Senate Health and Welfare Committee, and it is February 18th. Today, we're looking at some bills that we've been working on. The first one will be on the cognitive disorders issue S206, and then we'll move into our mental health bills and have a discussion on how to move forward with those. There are some updates on 206 and on 197, and then we'll be talking about what we're going to do with 194 and 195. I want to stop talking and allow Katie to go ahead because we have limited time with her this morning. So, good morning.
Good morning.
Katie first, let me just say thank you to Ruth for Senator Hardy for working with Katie on S206, and if there are questions, we can ask Senator Hardy as well. This is great.
Okay, Katie McGlynn, Office of Legislative Counsel. I'll pull the document up on my screen.
Okay, good.
Okay, so this is a committee amendment to S206. And we have, I guess maybe before we look at the language, it diverges quite a bit from the original version of the bill as introduced. So you'll see a few similarities, but I think it sort of stands on its own. So first, in section 1, we have the statutory language for the existing Commission on Alzheimer's Disease and Related Disorders. And subsection B, it governs the membership of the commission. And you'll see that on line 12, it currently has 20 members, and that's been changed to 21 members to account for adding the executive director of the blueprint. And then
should we ask questions going through, or do you want to go through how many pages is it? 10 pages. Just quickly, just what was the rationale for adding the blueprint, folks? And Ruth, you may want to, or Katie.
Yeah, so in talking, just to let you all know the process that Katie and I went through, she and I went through all the testimony that we got on the bill, and also had a couple meetings with representatives from both the Department of Health and Dale, as well as the Alzheimer's Association. And then we had a meeting with all three of them together on Tuesday to go over a draft. So the Blueprint for Health, the Department of Health has been working with them closely on a lot of the Alzheimer's prevention work, and is trying to develop a more comprehensive program with them. So in hearing about that, we discussed that it might be helpful to have them at the table on this commission. So we added them. I will note we didn't ask them, but they came up multiple times in the conversation, so it seemed like a logical connection to make.
Okay, sounds good. Anyone want to add further? Okay, is everyone, if you're not okay with it, please let us know. Okay.
Okay, we'll keep moving. So part of the membership, if you look on line 17, the members appointed by the governor shall represent the following groups and organizations. So there's language added here to include hospitals, hospital and nursing home managers. We already had nursing home managers, so this hospital manager. And then on line 20, striking a representative from the business community. And
do you want me to just say the logic of each of them, or do you need to leave, Katie? Should we just, I don't know about timing.
It's fine with me. I'm here until 10:30.
Oh, okay, great. So that one that we heard testimony from about hospital placements and transitions to and from hospitals, and hospitals being more involved. So we added hospitals there in order to keep the commission not too big and to not add cost. We got rid of the business community because they seemed like the least sort of directly relevant. So that was the logic behind that.
Okay.
Okay. I wanted to make sure I wasn't on mute. So next, when we're looking at this language with regard to the membership, there's language that's been added to sort of describe the type of experience that members who are appointed by the governor should have. So they shall have direct expertise or experience working with or caring for individuals impacted by Alzheimer's disease and related disorders, expertise in clinical and medical research on Alzheimer's disease and related disorders, or knowledge of health systems and policies to equitably address Alzheimer's disease and related disorders, and shall represent to the degree possible 5 regions of the state. That last part is existing language.
Yeah, and this was just to make sure that the people on the commission, I think they are, but there was some concern about making sure that there was more knowledge of Alzheimer's and how it impacts people. And the 5 regions of the state are the 5 areas on aging regions.
Okay.
Okay, so we're still in the language, the commission's statutory authority. In subdivision 3, we've removed a sentence that refers to the commission may participate in the development of rules that were required in 1996. Those rules have been adopted a long time ago, so we're removing that reference. And then there's the addition of subdivision 6. This is in the duties of the commission, and there's an added duty to advise and provide written comments to the Departments of Health and Dale regarding the development of the state plan on aging as it relates to Alzheimer's disease and dementia, and then any other relevant plans. So this is to capture plans that the health department is working on, and we're sort of referring to it a little bit more vaguely because the one plan in mind, the CDC plan, may not be ongoing for years to come. So we're just sort of referring to it generally.
Okay. If
Okay,
anybody has a comment or question, just speak up.
so this next section, section 2, is existing language with regard to, well, it requires the state plan on aging, excuse me. And there's new language added in the lead-in of this section to indicate that in addition to the plan on aging, describing a comprehensive and coordinated system of services, supports, and protections for older Vermonters, that this includes individuals with Alzheimer's disease and related disorders. So in adding this language, it's sort of adding an extra layer to the analysis that's happening throughout the entire state plan on aging. And it's the intent that by adding this language here, that older Vermonters includes individuals, including individuals with Alzheimer's and related disorders, that with regard to all of the analysis required throughout this section, that this group of people will also be included in the analysis.
Okay. I mean, it may be that they would be considered anyway, but it seems that with an increase in the numbers, that makes a whole lot of sense.
Can I just ask a question about that section?
Oh, no, go ahead.
Thank you. As far as age goes, it seems to me that by including that, it would also include people who are not elderly who have Alzheimer's as well, correct?
Exactly. Yeah, it was meant to capture the broader age group for people who may have early diagnosis, and to really call out that Alzheimer's and ADRD, as it's called, would be part of the plan very explicitly.
Thanks.
In the existing language for the state plan on aging, there's language that at least 60 days prior to adoption of the plan, the commissioner is to submit a draft to Dale's advisory board. And this adds that 60 days prior to adopting the plan, it shall also be submitted to the Commission on Alzheimer's Disease for advice and recommendations. Then we just have conforming change that the advisory board and commission shall provide the commissioner with written comments on the proposed plan. And then we have a new standalone subsection that is specific within the section within the section on the state plan on aging that is specific to Alzheimer's disease. So with regard to individuals with Alzheimer's disease and related disorders, the state plan on aging shall address the following list. First, home-based care or placements and hospital and long-term care placements and transitions to and from care in home, hospital, and long-term care settings. Secondly, support and education for families and caregivers. And third, strategies to promote affordable and accessible long-term care and home and community-based services to individuals with Alzheimer's disease and related disorders.
And these three were specifically called out because based on the testimony we heard, they seem to be kind of pressure points for people who have been impacted with Alzheimer's. All the categories prior to this that are already in the plan would also have to address Alzheimer's, but this is much more sort of explicit. So that's what we all felt were the three biggest pressure points, so to speak.
Yes, we certainly heard this in our testimony, so it's good to have it included.
Yeah.
Okay, so the next section, section 3, is session law. And maybe before we look at the language, I'll just sort of describe what's happening. So right now, the state plan on aging for years 2023 to 2026 is in process and being worked on. And so at this point, was Dale to include a detailed look at Alzheimer's disease and related disorders and integrate that into the state plan? It would maybe set their work back a bit. So what is happening here is that in preparing the state plan, the department is to include as an addendum, the state plan on Alzheimer's disease and healthy aging, which is a report that the health department is putting together. And I think they're completing their work around May. So instead of having a fully integrated state plan on aging report 2023 to 2026, the Alzheimer's evaluation and looking more deeply at Alzheimer's disease and related disorders will happen through an addendum that the Department of Health is currently working on.
And this was sort of a compromise between holding up. We didn't want to hold up the plan on aging, which is both a state and federally required plan. And we also didn't want them to have to do a formal amendment to it because that takes a lot of time and it also costs a lot of money. So this was the sort of compromise where they would still have a fully fleshed out plan about Alzheimer's, but it wouldn't be fully integrated the first time around. So the second time
that's
we do the
great.
plan,
That makes a lot of sense. That's good. That's great.
yeah, Katie and I there are so many plans and trying to integrate and coordinate them. So this was our attempt to do that without making it a hassle or a cost for everybody.
Yeah, good. Okay.
Okay, so that brings us to section 4. In section 4, there's a new chapter being created entitled 33, specific to Alzheimer's disease and related disorders. In the first section, 6251, this directs the Department of Health and Dale to jointly develop and maintain easily accessible electronic, print, and in-person public education materials and programs on Alzheimer's disease and related disorders that shall serve as a resource for patients, families, caregivers, and healthcare providers. And the departments shall include information about the state plan on aging, as well as resources and programs for prevention, care, and support for individuals, families, and communities.
I have a question here, but go ahead, Ruth, first, and I'll ask my question.
Okay. So this was one area where Dale and the Department of Health said that they already do a lot of this stuff. In looking through the materials they had, it didn't seem like they were hitting the mark exactly of what people needed. So, based on, feedback from the Alzheimer's Association and things we were hearing from our witnesses and others, it seems like the materials need to be more targeted at sort of like a how-to or resources that were actionable, in addition to all the sort of prevention materials that they're doing. VDH is already doing a lot of prevention materials, but I think we heard from families when they're get a diagnosis, they need to know, what do we do? So this was aimed at that. So this was the one area where I think I wouldn't say there was disagreement, but I think VDH and Dale thought they were already sort of doing these things, and they were a little concerned about having it called out in here. But they also understood that this does then mean that they have cover to do what they're doing and sort of, carry on with continuing to improve it over the years, that this wouldn't be done overnight, but they would have this sort of order to do it
ongoing
ongoing.
responsibility.
Thank you. That's it. So I told you I would point out areas where everyone was not in agreement, and this was the one. And it wasn't that anybody objected to this, but I think there was a feeling that maybe this isn't totally necessary. So
right. No, but we did, when we heard from the family in your district, and that they didn't have a good grasp of what they could do and where the resources were, that became very clear. So I'm hoping that there'll be some reference to 211 and you've got electronic access in here. So this is good. Yeah.
Yeah. And one thing, I think that the Department of Health and Dale thought that some of these resources should be and are provided by the Alzheimer's Association, and they are. But the Alzheimer's Association was concerned that a lot of people don't go to their website because they don't consider, they're either scared about thinking about Alzheimer's, or they may not directly have an Alzheimer's diagnosis. It could be a related thing, and so this was an attempt to sort of get beyond the stigma of Alzheimer's as well.
I guess the question I would have here is, was there any discussion about linking this information with healthcare facilities or areas where diagnosis might be made? So that's something we can think about going forward, but whether that was a discussion.
To like for hospitals and healthcare providers.
Yes.
Not
Area Agency on Aging, even though that may not be the first place people go.
Right. I think that there was the assumption that these materials about resources would include those resources.
It does say healthcare providers. I take it back. It's right there.
Yeah.
Good. Okay. Okay.
Okay, so the second section in this new chapter is the creation of the permanent position of the Alzheimer's disease coordinator that's to be shared between the Departments of Health and Dale for the purpose of planning, public education, and coordination, as informed by the recommendations on the existing commission, the state plan on aging, and other relevant statewide plans on Alzheimer's disease and related disorders.
Is there going to be a fiscal note with this one, or is it a current position that's going to be shared?
So this is not a current position. So this was
dear.
another area that I, doing, being totally honest with you, excuse me, they, both Dale and VDH, I think, this was not in the governor's budget, and they were very clear about that. So to cover they did not ask for this, but they also were really clear that they don't have the capacity to do all the things that are necessary in the state planning process and in supporting the commission and doing all the outreach. And one of the reasons they don't have all of the materials that we would love for them to have is because they don't have a person to do it. So this was an attempt to get at that. And they really felt like a shared position would be the most effective. They have other shared positions that work really well. So I said to them, let's put it in here and we will have a discussion about it at the committee, but we would need to get a fiscal note probably. There is possibility that we could say that it would be transferred from an empty position elsewhere or vacant position elsewhere, but yeah, it does add, it would add a trip down the hall. So that's up for the committee.
Yeah, you're right. And so let's come back to this one. If I don't know whether Katie or Nolan knows, if we can put in the language that it would come from a current position or positions within the two departments. So maybe we can come back and talk about that one.
Okay.
Yeah.
Okay. So the next section has to do with professional education opportunities. So the bill is introduced, talked about CLEs, and this version is not as focused on CMEs. Instead, this asks the chair of the Commission on Alzheimer's to appoint at least 3 members of the commission to serve as a work group for the purpose of making recommendations to achieve a dementia-capable workforce and promote and expand opportunities for healthcare and human services providers and first responders to improve the diagnosis, treatment, and care of individuals with Alzheimer's disease and related disorders, and to support their families and caregivers. In developing these recommendations, the work group is to consult with relevant stakeholders, including licensing entities related to the professions specified in this subsection.
Okay.
This was an attempt to get at the professional development without making any requirements, and also to include all the groups. We didn't want to list out everybody because we felt like we would forget somebody, but just make it clear that it was also, the Board of Nursing and all those places that do licensing. And the Alzheimer's Association, who is on the commission, felt like there would be commission members who would be really interested in working on this. So that was our sort of compromise between requiring something, but also making sure that something is happening with this area.
Nothing like a work group. It'll happen.
And these are existing people, so it's not a new work group.
No, we're not doing anything. Just another task.
Exactly.
Okay, that's good.
So in terms of process, the small work group is submitting its findings and recommendations to the full commission by November 1st of 2023. And then upon approval of the full commission, the work's findings and recommendations go to the General Assembly by January 15th, 2024. And then we have the effective date, which is July 1, 2022, except that Section 2, the plan for the state plan on aging, would take effect January 1, 2023. And the reason for that it's taking effect later is because, as we mentioned before, they wouldn't have time to integrate Alzheimer's and related disorders into the plan that is coming out January 1, 2023. So by pushing back that effective date, that requirement doesn't apply to the plan that's in development now for 2023.
Okay. All right.
One thing, Katie, I'm sorry, Ginny.
No, go ahead.
That I just noticed when you first pulled up the draft is we might want to change the title because it talks about treatment and diagnosis, and we're really not doing that anymore. So maybe planning and support, education or support or something like that instead.
Yeah, I like the planning and family support or support for Alzheimer's patients and families. I like that. That would be great. Because I think you've done that. You've really identified some places where people need support and put those things in place. It's good. So on the questions committee for Ruth and Katie. Okay, going to that section where there's the shared position, Katie, would the committee be interested in looking at language that would say it would come from some existing resources. It's hard because we're going to hear that nobody has existing resources that can move into these positions, but I'm just thinking maybe it would help us to look at the language and think about that and get some advice from joint fiscal.
Senator,
Go ahead, Cheryl.
Thanks. Senator Hardy mentioned open positions or positions that, haven't been
Right.
filled. So that
Right.
would
That's the kind of
have the
thing.
money in with it. I mean, would the money be included in that?
That's the kind of thing we'd want to look at. Yeah.
Yeah.
Yeah,
it
there's
seems
some
to be-
language that I've seen in other bills about
Yep.
this position shall be, transferred from an open position, blah, blah, blah.
Right.
Katie, you might even know it, cut and paste it from somewhere, I'm not sure, but we didn't discuss that in our little group, but that's an option. As if we wanted
I
to do the
think it
position.
it's probably an option to send down the hall, because then it's not as significant as starting a brand new position. And so it'd be maybe it's easier to find the resources. So,
Mhm.
I don't know.
Yeah, and if we don't want to send this down the hall, we can take the section out. But I do think it is, we are giving them more work to do and not giving them people.
Here's
to do
a
the work.
question. There's another alternative is to ask them to come back with a recommendation for a joint position and make that a date certain. I mean, that if let's look at both of these and then we'll have to think about, and maybe we can talk with folks down the hall. I can do that and see which one might be most appealing to the committee and able to be dealt with.
Oh, to have them come back like next year to recommend a joint position or something like that? Is
Yeah,
that what you mean?
yeah,
Um,
right, something like that. And I don't know whether you had talked about that with them or not.
I had not. I mean, and I don't want to get them in trouble. They didn't have the authority to ask for a position. So just to be clear for anyone's
We get
listening,
it.
they did not ask for the position.
No, but it sounds like it's important from what you're saying.
Yeah, I think that one of the issues is that they don't actually have a position dedicated to actually work on the state plan on aging either.
Right.
When we passed the Older Vermonters Act, we didn't give them a position to do that. So now we're adding extra work on top of that. And they're scrambling to find people to do all this planning. And
This makes sense then to look for an open position that could be transferred or something. If we put in a brand new position, let's look at the language side by side, Katie, and see what our thinking is and think about this. What I think we could probably make a decision on Tuesday. I know we want to get this bill over and out, but let's just spend that time and look at the language. And Katie, can you maybe link with Nolan on this one and see what
Yeah, I just emailed him to
okay.
ask if he was listening and to hear what his thoughts were on transferring position. I don't know if he was able to join or not, but yeah, I can connect with him.
Yeah.
Ruth, does that sit well with you?
That's fine. I just don't want to hold up the bill. It's a bill we can check off our list, and I would love to check it off our list. So
I would love to check off about 20 of them. So, but
exactly. That's where I'm feeling too. So if we can make a decision and vote on it on Tuesday, that would be fine. But I don't really want to wait too much longer than that. And I feel like this probably won't get through as a new position. But
no, I don't think it'll get through as a new position either. And that's why looking for alternatives we'll do that. And then we may decide to strike the whole thing, or we may decide to have them come back with a recommendation. There's some options that are not fiscally involved.
Yeah, and we were careful not to add anybody who needed per diems onto the commission. We took one off and put one on, and then the blueprint person is already salaried, so that wouldn't add money.
That's good. Okay, committee, questions about the bill and any concerns about moving forward with this on Tuesday for a vote? And we'll with the language improvements, changes, whatever. Okay.
Yeah, the position and the title. Oh, there's
Yeah.
Nolan.
Oh, no, let's have a final discussion on this. Welcome, Nolan.
Oh, hello.
How are you? Katie, why don't you point out the section to Nolan and maybe just describe the
Sure.
dilemma we're in?
Well, before I'm gonna open the bill, or can
All right.
someone?
Do you
send me a
want,
link
I'll
to
just share my screen, Nolan. Okay, so the committee is interested in possibly creating this position of an Alzheimer's disease coordinator that would be shared between the Departments of Health and Dale, and it's a permanent position. There's no money appropriated for that purpose in this bill, and the committee is talking about possibly transferring a vacant position from elsewhere. So I think the committee is looking for your thoughts on this, how frequently that's done.
Okay. For the record, Nolan Langwell, Joint Fiscal Office. I think that just because there's an existing position, if it's an empty position, it's potentially not funded. So you'd still have to find the funding,
I'll fund it.
right? So I think we should go with the assumption that you would need to fund the position. And generally, positions, when you think about salary, benefits, all the administrative costs, will probably run you around $100,000. So that's what I would put. Usually with the positions, depending on the type of position, I would put a range of anywhere between 85 and 110, depending on where it falls in the steps and the person with whom the experience lies and what their health benefits cost, et cetera. So if that gives you a sense. Now, if the administration were supportive of it, then, you know, when they know their books, they're the ones who could say, we love this. Oh, and by the way, we funded this position and it's not filled, so we'll happily use that funding for this. But I don't see that happening. That's harder for us to be able to say. So I think we need to go in with the assumption that it would require a position or require some funding for a position, even if it's an existing position, it's not funded. So that's my default.
Okay,
That makes sense.
yeah. Go ahead, Senator Hooker, go ahead.
Thank you. Thank you. And Nolan, how would that look with a shared position in those departments?
You know, that's a good question. I don't know if we have shared positions. Usually it would fall in one department or the other. I don't know if we have positions that actually fall into, so which two departments were we looking at again? It was Dale and
DOH.
QH.
They actually suggested the shared position because they said they had other shared positions that worked well. So I
Okay.
don't know if they have shared positions that are official shared positions, but they seem to think that there were some positions already that worked well, that worked with both departments.
I mean, sometimes it could be where the 50% of their time is devoted to one and 50 is the other, and they fund it that way. And that's how they're counted as two half-time FTEs. I can connect with someone over there, but I think that gets into the weeds that you probably don't really need to concern yourself with.
Here's my suggestion, because I know that we've got Shayla in the waiting room who needs to leave at 10. I'm thinking, Nolan, can you pursue that question?
Yeah.
And then Katie will look at options, language options. The one that leaves us without having to go down the hall is report back with how it would happen. Then we have the shared position with an empty position. And then we have the outright fund it as it's in the bill, I think. Those are three options.
Sounds like it, yeah.
Okay. So
Are you-
let's,
Are
Go
you
ahead.
looking for language when you come back in a half hour or when you're done hearing from Shayla?
only if Nolan has reached out and has
I will-
information.
I am so backed up right now.
Yeah, so
I will
I'm
not have an
thinking
answer.
this is a Tuesday decision unless we all decide we've land on one of the three. Yeah. Okay.
What I can commit to doing is I'll reach out. I'll probably talk to Shayla or somebody and figure out how I could work and
Okay.
if there's positions available and do they have funding. I'll find all that out. But
Okay.
I would assume the default for now should be to assume that it's going to cost some money and
Yeah.
we'll go from there.
Every bill we have is going to cost some money practically. So
You're keeping me busy.
Going to keep you busy, right? Well, we want these bills to get out onto the Senate floor for reporting, and we don't want to see them held up anywhere on the way. So that's always a problem. Okay, Katie, we'll hold that, and thank you, Nolan, for being available to us.
No problem.
Okay. So let's, Aaron, why don't we have Shayla come in the room? Are the other folks with her?
All three of them are here.
Right. Well, we don't want to get into a full, well, maybe we will. Well, this time we can move on to 194, 195, and 197. But I did want to have Katie talk with us initially, and then Cheryl a little bit about the work that they've done on 195 and 194. So, but first we want to hear from Shayla, who has a limited time. And then we'll go back to Katie and others. Let's go ahead, Senator Harvey.
One
Go
thing,
ahead.
sorry, Madam Chair, were we going to vote on 654 today so we can get that moved along?
If we have, no, because Jen is not available. We will vote on it and we have it scheduled early next week. I think it's on Tuesday.
Okay.
And that's been, we're ready to go on that one. So, and we'll wait, we'll do it with Ledge Council. Okay, so Shayla, thank you for being here. I know that people have reached out and chatted with you about our mental health bills, and you have a limited time frame, so we welcome your testimony.
Hello, committee. Thank you so much for accommodating my schedule this morning. I do appreciate that. I'm Shayla Livingston. I'm the Director of Policy for the Agency of Human Services. And we, the Department of Mental Health, I'm here representing the Department of Mental Health, as I have been their policy director as well, up until recently, and I'm supporting them in that manner as well. So you've heard from the Commissioner of Mental Health on this topic, and I think also maybe the Deputy Commissioner, but I want to be very clear that the department is incredibly supportive of peer certification and peer respite beds, that's something that the department has been looking at and working on. And we sent you a memo, and I'm just going to very briefly hit on the high level of that, and then I'm happy to answer questions. Essentially,
let me just make sure the committee understands that that's a memo from Commissioner Hawes, and it was addressed to Cheryl, Senator Hooker, and myself, because we had been working on this area together with the department. So, but it's on our webpage.
Thank you, Chair. Yeah, exactly. In that memo, the department just outlines briefly the work that is underway right now on peer certification. So the department included peer certificate has requested a white paper, requested a white paper on peer certification, and that was published. And then the department has worked with Pathways on a grant application to the department using HCBS funds that we requested in the BAA that is pending in front of the legislature. So those HCBS funds would fund, I believe it's Pathways, but a grant to examine peer certification and come up with a framework for that certification process, including definitions that the committee is considering in S194. We've also been in communication more recently with OPR on this topic and would include OPR in that process and in that work group to ensure alignment, and also leverage any of their resources that would make more sense to include in this process. They have a really specific process that Lauren is much more able to describe to you than I am, but I do think that it is important that we work hand in hand with them, as well as with Pathways and the peers to consider this for Vermont. The Department of Mental Health is committed to this. We want to do it. We don't want the committee to feel that we are slowing it down, but we do want to do it deliberately. And we do have this process and this funding already in place and already in legislation pending before you all right now in terms of the funding for it. Following that, and again, I want to be really clear, we are supportive of the respite bed concept. We do think that it makes sense to solidify and finalize the peer certification work, and also to potentially leverage the information from the beds that we already fund in order to get the committee the information you are looking for in the pilots that are described in S195. That way we could use existing resources and information, as well as the process that would be set up through peer certification, in order to then walk into considering a framework for respite beds for this state with more information and with a peer certification already set up. I think the last thing I will say on that topic is simply that the funding that is outlined and described in S195, currently we would need to make some modifications to that if it were feasible. And I do just need to say it's not in the governor's budget right now, so I'm not clear where that money would come from. At least in the department's budget, there is not room for that. So again, happy to take questions, but I do want to be super clear that we are very supportive of both ideas and concepts and are already working and have been working on the peer certification front actively and do fund those respite beds and are interested in that. Oh, sorry, one more thing. We did do an RFI as part of the capital bill, and we did get some responses to that RFI. There's a report, Act 50 report, that I'm happy to send to Erin to post on your website or your webpage as well. We did that report for this year, and 6 different responses for unlocked community residential beds were provided to the department around ideas for how to improve community access to those residential beds, and many of them did include peer aspects. So that also might be of interest to this committee
That is
to
not
review.
true. No.
Okay.
I'm happy to take questions.
Yep, I've got questions. So I guess we've been working on this now for over a month. So we're happy to finally see something in writing that helps. But there is a concern that we have, simply because, as you know, and probably as a department and the agency is concerned, we'd like to move forward. And so every time we take a step forward, we somehow take 2 steps back with a working group or a report or something else. And the ideas from the RFI are ideas. We're frankly, and I know we've talked about this, and I know that the agency has had huge turnover and changes, and the pandemic has been going on, but we certainly would like to have some recommendations that we can have in the bill. And Senator Hooker's been working very hard on this, that we can take that step forward without having to backtrack. So is there, as you're looking at the bills before us and then at your memo, and we're going to have to call through the memo with our ledge counsel, it will be helpful to have some proposal that does take us that step forward. And having said all that, of course, we do understand the conditions under which you are working, but we know that there are folks in the community who are really ready to go. So we want to make sure that we're capturing the enthusiasm and the energy that exists out there in our real world. And that we can move forward. And I'm going to turn to Senator Hooker and first with your questions, and then Shayla, please, we welcome your comments.
Okay, thank you, Senator Lyons. And you've said a lot of what I've been thinking. And I guess the point is we have people who are already in place, ready to take this on. What do we need to do to move that forward rather than going back and retreading old ground? So if you can, what can we eliminate, I guess, so that we're not duplicating the effort, so that we can just, start here and move forward and get this in place as quickly as possible. I mean, we have increased need. We've seen it through the pandemic, and I don't think it's going to go away anytime soon. So the quicker we get on this, the better off we're going to be. So what would you look at as a timeline for this, I guess, if it goes through the process that you're explaining?
Absolutely. And I appreciate that very much from both of you, the urgency around it. If it's okay, I do want to phone a friend a little bit with Lauren to describe their sunrise process for this type of certification. I do also want to be super clear that as soon as the BAA passes, that grant to actually propose, that goes forward to propose a certification framework, is ready to go. So it's not like then we have to write the grant, then we have to think about, like, you all say, yes, we are ready to move on that. So that process could start basically almost immediately. The question around respite beds and where to put them and who can catch that work and, building them. So again, I just want to be really clear on the process. If we stood that up, there's some questions around would it be a pilot? Would a pilot make sense? Is that actually what would be the best use of resources in this moment, given what we already know around this work? Should it be more of a consideration going forward once we have peer certification in place and a framework in place of standing up and not necessarily doing a pilot? Because pilot work in this type of area means that you're building beds and building spaces without the security of ongoing funding. We would need to pull DEVA into this conversation in order to make sure that there is security in that ongoing funding. That does have implications. I've read the analysis and some of the pieces in the bill, as well as other research around the cost savings in these. And so I do think that is, that would absolutely be part of that conversation. But again, it does require that consideration in the budget process. I do apologize for the fact that you guys have been working on this for a month. We did come in and testify on it, I know, but we did not give specific details and feedback. So there has been some turnover in staff on our end. And so I do apologize for that. But if it's okay with the committee, if I could hand this to Lauren to answer the question.
You can, but before you do that, I just want to discriminate between what we currently see as peer-to-peer certified programs in the state. And I know that we've heard testimony, for example, from Sandy Yandau, who has been doing peer-to-peer support and is certified under a federal umbrella. But so this peer-to-peer support, just to reassure folks, we are not looking at psychotherapy. So we're not looking at master's credentials. We are looking at people who have known experiences in the area of mental health issues, supporting their peers when they have a short-term need. So I'm trying to understand, you mentioned the word sunrise, and we'll listen to Lauren. We always listen to Lauren. And then we'll try to sort out the differences and what we think we're hearing. So thank you.
Yes, Senator, I agree with you that we're not talking about psychotherapy.
Terrific. I'm glad we're on the same page with that one. Okay, Lauren, thanks. Go ahead.
Hi, I'm Lauren Lehman with the Office of Professional Regulation for the record. So it's good to hear that it's not talking about psychotherapy. OPR just, this is a new concept to us, not being, being more in the licensing space than in the mental health field. We regulate a number of mental health professionals, but mostly from the licensure perspective. So when reading this bill initially, it was unclear to us whether there would be some form of psychotherapy being used by peers in support of other peers. Looking at Ms. Yandow's testimony, it seems she did request some information, change in the language to be practicing therapy. So that was of concern to us. So because what OPR has right now and what the state has decided to, under its policies, is practical, is a roster for anybody providing psychotherapy without qualifications. You don't need to have any qualifications, or, and by qualifications, I mean certain education or certain examination. But if you're providing psychotherapy in the state, it's a consumer protection element where you just register with OPR. So a consumer can check on our website to see, hey, this person's is checking in if there's any discipline, if there's any concern about their practice previously, because we recognize the consumer is in a uniquely vulnerable position when seeking psychotherapy. So for our perspective, if this is exclusive of psychotherapy, that would bring a new level of detail to this. The Sunrise report, to Shayla's question and to Senator Hooker, is really looking at right sizing regulation. Currently, peer support is permissible in the state without regulation, and that is exempt from all of our Title 26 mental health profession licensure requirements. There's an exception for peer counseling, regardless of whether consideration is received. The difference, I think, in this level is that they're asking for state, the S-195 asks for state approval. It's asking for a state certification. And traditionally, when we offer that state certification, we go through this Sunrise process, which is tied to what we see as a keystone fundamental policy. We don't regulate a profession unless there's a threat of public harm to the public. And once finding that harm, public harm of unregulated practice. And if there is a finding of public harm, we do the least restrictive form of regulation possible. And this just means that we're trying to stay out of burdening workforce entry. In this situation, I would think obviously there's a potential for public harm if there's an unregulated practice of this industry. Maybe not, or if this profession, maybe not. And that would be our kind of threshold question in a Sunrise report. And then if it is there is found to be a public harm, we would look very closely at, well, what makes sense? Do we want roster or registration, which means everybody has to register, but there's no educational requirements or other requirements to obtain it? A certification is optional, so folks could choose to be a certified peer support specialist, but to obtain that certification, they'd have to demonstrate certain qualifications, or a license, which would require both qualifications and be mandatory. The reason I think it's necessary to do the report here, if OPR is to play a role in this certification, is there's 48 other states doing this. I've done in the past 2 weeks a cursory review of their approaches. There are a myriad different number of approaches, but there's definitely best practices. There's also the reason for having the state certification is to pull down Medicaid funding and to have funding for the services. And I want to make sure that anything we draft, anything we put into law is consistent with those policies. So we're not just putting something into place where we're not getting reimbursement. So those would be my concerns. We do reports every year. We would have this by December 15th. So it could be something that could be taken up quickly next session and passed pretty immediately. I'm not sure what your ideal timeline is, but that would be our timeline.
Yesterday would be great. No, thank you for that. That's helpful clarification. I guess the question would be that what I'm hearing you say is that folks can continue to be peer support specialists if they're not certified. There's nothing that would state that they would be barred from working in a peer support capacity.
Absolutely.
But now, so then that raises the question about the guidelines, the conditions, the criteria that are in the bill that would define who in this state could be a peer support specialist. And we might add into that until we feel that they were acting appropriately, and then also put in your sunrise, your certification sunrise. Is there, I'm trying to sort out what the barrier is to having the folks continue the work to be considered peer support specialists, and at the same time, by December 15th, getting your sunrise report, because you did indicate that they can do this.
Yes, from my perspective, the current practices that Ms. Yandow and others are engaged in can continue. I think the other benefit of waiting is the grant Shayla was talking about is really designed to provide structure. As currently written, it's not clear what the scope of practice. As I said, I didn't realize that psychotherapy was not a part of it. And so it's not, if OPR were to come in to regulate this, it wouldn't be clear to us who was providing the service, who wasn't providing the service, what service was being provided. The grant would help clarify that. But again, I think what S195 does is it provides a state certification which allows for Medicaid reimbursement. And that does not prevent the current peer counseling services to continue. It just wouldn't allow until legislation takes place. I don't think it, and DEVA would have to actually answer that. It wouldn't, under this structure, be I don't believe it would allow Medicaid funding for it. But
okay, yeah, this is very helpful, because I mean the goal is to have an expansion of services and as well to have some reimbursement in place. So now we're beginning to see the dichotomy between the folks who currently are peer support specialists, those who are certified, those who are not, those who are certified, and then what the state might do going forward. It's not it's a trichotomy. Okay. Anyway, Shayla, go ahead.
Yeah, and I wanted to be clear that we do have, like Lauren said, we do have folks already working under our current, guidelines and regulations. And I don't know that we need anything to in legislation to allow them to continue to do that. But like Lauren said, I think that it is, the department wants to do this so that we can advance the field. So it's not I don't know that we need more in the interim, but we do need this next level, or want this next level in the future.
Nobody wants us to pass legislation. That's so hard to understand.
You can Lauren and I are welcoming you to require us to do this. We won't do it.
We are going to require something. I mean, this committee is very passionate about this area. And so we're going to work as hard as we can to have something in place. And we need to work with you, obviously, and that's what we're doing. It's unfortunately taken a while to get here.
I apologize. I do have to leave.
I understand. So we're going to resolve these issues, and we're going to get some language put forward. Senator Hooker's been working very hard on this, and so we want to make sure we move forward. Senator Hooker.
I'd be happy to do that with you.
Senator Hooker and then Senator Cummings.
Thank you. Ms. Livingston, you talked about wanting to proceed with the certification before doing the respite beds. And I really am concerned about that, because I think we have a need for these beds now. We have people who are working in at a LISM where, they know what they're doing. We've seen the progress and all of the good work that this particular program has done. This is our pilot, I think, and I would like to be able to move forward with the respite beds with the peer support that we have, even though these people are not certified yet. But I would hate to see us hold up the implementation of more peer respite beds, waiting for certification of the peer specialists. So I hope that makes sense. I want, we really want to see the beds put into place.
Okay.
I hear that for sure.
Senator Cummings.
Yeah, I think the big change here is the Medicaid reimbursement.
Mhm.
And that peer support goes on, we have it in substance abuse, we've got it in mental health, but we don't pay for AA treatment with Medicaid. And that's what's going on. The other thing I've been told is that we have a ceiling in our Medicaid waiver,
Yes.
and that for the first time we are coming up close to it. So if we take in another huge program, we may be, stopping our ability to do something else because of the way it's set up. So I think that's why folks are being a little cautious, is that there's state money going into this or request for the first time.
Right. It's that is the issue. That is a huge issue on this. And in my conversation with Senator Kitchell, we discussed that. So we would have to look to DEVA to give us some input should we decide to go forward with everything at once. And, it's maybe it's the expansion that can go on with the current system of support, and then the certification is in place with some guardrails and information from DEVA on Medicaid reimbursement. Those are the kinds of things that we really have to juggle here without stopping forward progress. And thank you, Senator Cummings, for bringing that up.
Mhm.
Sheila, did you want to comment again? I see you. No. Okay.
Yep, just agreeing. Yep, thank you.
All right. So questions committee for Sheila before she has to leave. We're not leaving this one. We're going to stick with it. We're going to bring Katie McClinn on board, and then we'll hear from Katie and Cheryl. And I know that Lauren, you're still here and would welcome your being here. And then Wilda White has asked to be involved in the discussion. This is going to be more of a discussion than testimony time. So we want to continue with this.
Thank you for having me, and I'm sorry. I
No,
have to
thank you
go.
very much. And don't leave the issue.
Not
We're
leaving
going
the
to,
issue.
we need you and the department to work closely with us to make sure that we have some language that, as we said, is going to take us forward. So thank you.
Absolutely.
Okay.
Thank you very much.
All right. So Cheryl, I'm going to turn to you because you've been working on this, and let us know where you have gotten with any changes to the bill, and then you can bring in Wilda or Katie as you think will be helpful.
Okay. I just want to make sure again, I guess I was a little nervous when Ms. Livingston mentioned the beds and, the connection between the certification and the beds. And I don't know that is necessary. And I would like to see the bed certainly moving forward. And I think we can come up with language for the certification piece that would be acceptable to everybody involved.
So are you suggesting that the bills be acted on separately?
At this point, I would think that if there's, I wouldn't want to see the respite beds held up because we don't have the language that we need for the certification bill. So at this point, I would say we should move on them separately. But I can get back to you on that.
All right. Well, we'll certainly hear from others on that. So Lauren has testified that the certification Sunrise could be completed by December 15th. And is that accurate, Lauren?
Yes.
And then the Sunrise needs to be, you might come back with a negative report, but we're not thinking that will happen.
I'm not. I think OPR supports this concept and has, and what we've learned over the last couple of months, it's a valuable resource and a valuable profession. I think our interest is making sure it's a defined scope and making sure it's something we can implement as a license or as a certificate.
Now, my question for you is, as you go through the Sunrise process, do you reach out to folks at DIVA, for example, and looking at what the cost implications are as you make the recommendation, or is that left separate? Is it simply as a profession with criteria for being that professional?
We normally, our normal process is in statute. And so if it's called a Sunrise report or the request is for a Sunrise report, we look at those questions of, we wouldn't necessarily reach out to DIVA unless the questions of, unless it relates to a question of like how to regulate, what the best way to protect the public. That said, we have had reports in the past, requests from the legislature to ask other questions or consult with certain stakeholders. And it is a very stakeholder involved process with public hearings, and we reach out to groups independently to ask for their feedback and input. And we try to really find that's the right size regulation for the profession.
Okay, so I think that as we go forward, if we do ask for a Sunrise, we may want to put some recommendations in place for you in that process.
Certainly.
We'll see. I mean, yeah.
Legislative Council Chapter
you just froze.
Oh, I'm so sorry. Am I back again?
Now you're back.
Oh, good. Chapter 57 in Title 26, Ledge Council might be able to assist with that, has our process, has all the questions and we're supposed to look at. And that might help figure out what the language is. And we're happy to help too.
Okay. Go ahead, Senator Hardy.
It does seem like we could move forward with S-195, even though my name's not on it.
Your name is all over it.
Exactly. I'll just stamp my name on it. Just kidding. And then with some modifications, like putting Addison County in all caps or something. No, just kidding. And then have on that, we can move for, as Senator Hooker said, I just want to sort of reiterate, we could move forward with the peer respite centers, knowing that there are people out there doing this work. The one issue, as Senator Cummings has noted, and others, that they might not get the Medicaid reimbursement in this first year or until things, but then we could tack on to that the Sunrise process and the requiring DMH to do what they're already doing, but making sure it's codified to
OPR.
to go through the process with the grant, et cetera, and do, I mean, because I think it is important that we go through the right process to make sure that we have the right certification so that we can get Medicaid funding, but also not hold up the good work that's already happening out there in the field. So that would be what I would like to do, and do it so that we make
I think that, and it seems like that's the direction we're headed. So that's good. Senator Hooker, go ahead.
I just wondered if Senator Hardy was considering putting them together, as we said, either separating the bills or putting them together. I don't know, I don't want to put anything on the respite center bill that would delay its implementation or sink the bill. So
hold that thought. I mean, Senator Hardy may want to, we all want to decide, keep them together or not, but I think when you were talking, You are unstable at this
My
time.
internet is unstable, so I'm not hearing everything that's going
As-
on.
yeah, we
There's
were,
like
and we
ice
could
storm
tell.
happening all over the place. So, but I see that Wilda has her hand up. I don't know.
Yeah, I was going to go there in just a sec. So what I'm going to suggest is that as we start collecting all these ideas to Senator Hooker, I'm going to have you work again with Ledge Council, and then we'll talk about one or two bills as we're going forward. Wilda, thank you for being with us this morning, and you've got your hand up. So we're in a conversation mode, but can you please offer your thoughts as you're listening to all of this?
Yes, thank you for allowing me to be here today. Wilda White, founder of Mad Freedom and representing the proponents of this legislation, the peer-led organizations here in Vermont. I really appreciate everyone's concern that we get this right, which is why we proposed the certification program to begin with, because we wanted to get it right. A couple of things I'll start with the sunrise. I can understand why OPR would want to do the sunrise, because they don't understand what peer support is. But I feel like if they knew more about it, they would understand how unnecessary the sunrise report is. Because remember, this is something that is happening in 48 states plus the District of Columbia. Most of the states do not have their Office of Professional Regulation involved in this, for the very reason that for peer support to work, it needs to look very much different, because it is, from the medical profession. And when I go onto the OPR website, as I've done over the year when I was doing this work, I feel like it would scare people away from using peer support, because it doesn't have that same ethos. And when you hear reference to this white paper that was done and this grant that was written, I was the one who authored both of those. And I feel like there are enough kind of, to quote a Senator Cummings, guardrails, that's the term we're using now, in that process to allay all the concerns that have been raised. And I think what I would like to propose is that we do separate 194, which is the peer respite bill, from 195, which is the peer certification bill, and that we look at and that we approve. There's like 3 steps in that peer certification bill. There's the developing piece of the program, which I think doesn't seem to be attracting much controversy, and I think you can approve that piece of it. And then there's the screening and training piece. I think you could approve that as well. And then there's the certification body. And I feel like I could offer you some language that I feel like would address all the concerns that have been raised here. And it would be splitting it into a 2-step process. So even if OPR were ultimately going to be involved, there would still need to be a certifying body that they work with, right? So they would be doing what they're referring to as regulation. But even their other professions, they work with a certifying body. And so you could approve that piece of the concept. And we could include language that says, okay, we're going to establish this certifying body according to the procedure that's being laid out in the bill. And then OPR could have a role as providing that administrative, that kind of back office work, such as creating that roster that you talked about, helping with investigations if it came to that. So I feel like there is a role for OPR and staying true to peer support values. And I feel like we could work that out if, just a conversation with OPR, just explaining to them exactly what peer support is without completely derailing the bill and lengthening the time to get this done.
Okay, yes, you're headed in a direction that I was thinking about earlier, and I noticed in the memo from OPR that there is a paragraph that says an inventory, to look at an inventory of certifications across the state, and that might help. So here's what Nolan has a comment to make before he has to leave at 10:30. So why don't we, Nolan, let you come in and make that comment? And I'm going to say, we're not forgetting what you just said, Wilda. And because I think that Senator Hooker will be working with Ledge Council on this. I will also be making myself available, as well as Lauren, and probably everybody else in everyone in DMH. So it sounds like a team effort outside of committee to get us going here. But Nolan, you had some comments to make about 194.
Sure. For the record, Nolan Langwell, the Joint Fiscal Office. And also, let me just say on the record, Wilda, thank you so much. I spent some time talking with Wilda on the phone, and she helped me understand the bill. And so let me just say thank you publicly. The only things I wanted to sort of flag was on the money. If you move forward with was it 7 centers?
Yes.
Unless we add Addison. It says $500,000 for each center. And I just want to flag that right now the appropriation for the 2 existing centers was actually $477, but then they got these one-time supplementals. So, but going forward, they're only going to get $477, but the new ones are going to get $500. So we could either give the new ones $477, or you give the 2 existing ones $500. Now, that's a lot of money, but I just want to make sure there's some parity, because the $24,000 I don't think is ongoing. I think it was supplemental as part of the emergency stuff. So that's one thing to keep in mind, is how much you give to each. The second, I think Senator sort of brought up, is like, we don't know. I don't know if it'll be eligible for global commitment. We have concerns there. So I don't know what kind of federal state match we would be looking at to fund these. In the bill right now is 3.5 for base and 250 for one time. So I just want to flag that discrepancy in the funding. And the second thing I wanted to raise is, and this gets to the normally we appropriate the money to DMH. My question is, and maybe Senator Hooker can answer this, is these centers don't exist currently, but we're giving grants to something that doesn't exist. So I guess my question, maybe this gets to a level of, who is the money going to? Are these organizations, they have to create boards? Do they have to show some kind of fiduciary responsibility? Like, how we're creating centers and then we're giving money, but who are these people? Who is it? Like, do they have to come together and form a 501c3? So this is like a consideration when you think about putting money together in the short term. So I don't have an answer to that, but that was a sort of a concern about, like, where does the money go? Unless they already exist or some of the groundwork's being done, that's just sort of a flag.
Or it could be some kind of an RFP similar to what DMH is currently doing. So
yeah, that might be the answer. That might be the RFP. Okay.
I think Wilda might have more information on that as well, if it's okay, Senator Lyons.
No, go ahead.
Yes, Senator Lyons, you're exactly right. It would be similar to the RFP process that the state already uses. And the vision was, as these get up and running, that they would be run as a network to achieve economies of scale, so that people weren't duplicating processes like human resources. They would get discounts on insurance. They would co-locate. They would do Medicaid reimbursement at a single location. So that's the idea, and that's the vision.
That's helpful.
Does that help? Thank you, Nolan. That's helpful. And I know you brought up the issue about the funding discrepancy earlier, and it's good to have it on the table.
It just helps when you consideration of if you move forward, how I would cost it out. That's all.
So it's what was 3.5 base, and
the bill currently has 3.5 base funding and then 250 one time, but that's for the
Right.
the partnership for the existing
Yeah.
one.
Yeah, okay. Go ahead, Senator Hardy.
Hopefully my internet holds up. It's really windy and icy here. So I think this is a question for Wilda. Is that okay if I ask her a question?
Oh, yeah, we're in
Okay.
conversation mode.
Is that okay with you, Wilda?
Yes.
So this has been a confusion of mine since the bill came out, since what I think it's 195 with the respite centers, the whole concept of the pilot. And it seems to me like there's part of the bill that's creating the actual peer respite centers, the ones that aren't already in existence. And then there's this pilot, which seems to be a sort of collaboration or partnership or something between 2 existing peer respite centers and a community center.
No.
Community center.
So I don't know if you've asked your question, but
I'm just, if you could explain the pilot part of it, that would be great.
So this is the pilot. So currently we have in the state 2 community centers for people with mental health challenges. One is in Burlington, it's called Pathways Community Center, and one is in Montpelier, it's called Another Way Community Center. And the idea is that each of these, if 194 is the peer respite bill. So if 194 would create these new peer respites, one would be located in Burlington, one would be located in Montpelier, and then other places. And so with the peer respite, with the community center in Burlington and the community center in Montpelier, they would each get an additional appropriation of about $100,000 to create programming that would coordinate the program of the new peer respite in Burlington and the new peer respite in Montpelier to achieve those synergies that we know exist between affiliating community centers and peer respites. And Sarah Davidow talked about those. She talked about there's a seamless transition when somebody leaves the peer respite and go, because they've already been introduced to the community center. It also helps create wraparound support services to that person when they're in the community, so they don't have to wait until they're in crises to access services. It also, one of the big problems about people with mental health challenges is that we're incredibly isolated and we don't have friends and community. And so this helps build that community. And then you can reach out, and people are keeping an eye on you before you're in crisis and helping you. And then oftentimes we see when people go to the community center and they've been working all day on a problem and it comes 5 o'clock and they have to go home, they freak out and they go to the ER. Well, if you have an affiliated, peer respite, you'll know during the day that this person is probably going to need some place to stay tonight. And you can work on that. And you can offer that person this respite service so they don't head off to the ER or do something worse. They just go to the respite, right? For that night. And then the next day they're back at that community center working those same problems. So ideally we would like every single new peer respite to have an affiliated community center, but that's a big ask, and obviously we can't do that in a year, but we want to get this idea piloted. And I think, yeah.
Can I just ask a follow-up to that? So that's helpful to understanding it. But the peer respite, new peer respite center portion of the bill could move forward without the pilot. And
yes.
The pilot could move forward without the other part of it. Is that true? Or do those peer respite centers need to happen first?
The pilot couldn't move forward without the peer respite because we are affiliating the peer respite, but you could remove the pilot out of the bill. That's true. And you would still get the 7 peer respites.
Okay. Not that I want to do that. I just, what my confusion was when we're creating these new things and then I see pilot, I was like, it was a chicken and egg thing. And I wasn't sure if the egg had to come from the chickens.
No. I mean, it's really, I think
it does, Senator.
we were trying to restrain ourselves, and we want to get this idea of affiliating them out. And so we thought, well, perhaps we can offer a pilot in this bill. But if it's confusing, we can take it out of the bill.
Maybe it's only confusing to me, but that's helpful. It's less confusing now. I get it.
Oh, look at
so thank you.
Senator, when you have a community center that gets fitted up with the respite center in Addison County, you'll be very clear.
Right. If we had one in Addison County, I'd get it better. So
Yes, you do.
I think there was a
Thank
little
you.
confusion too, because Ms. Livingston was talking about piloting the peer respite centers, I think.
Yeah,
And that
Yeah.
was, and I should have said something earlier, but that's why I said we have a pilot for peer respite in like Alyssum. They've already proven themselves, but the pilot is the connection between the community center and the peer respite center.
So this is a really great conversation, and the issue of the issues are beginning to become clearer. So I've asked Katie if she will work with Cheryl, with you and others to get us to a place where we understand what the money would be. So that's important. And Wilda, we need to be clear on how many people are waiting out there to begin a respite center. I mean, are there people out there right now who would be putting in a proposal if an RFP went out? And so
Yes.
Okay.
Yeah, I mean, everybody now who so Pathways would put in a proposal, Another Way would put in a proposal.
Okay.
Vermont Psychiatric Survivors would put in a proposal. Listen would put in a proposal to open up, and so there are people waiting to put these proposals in.
Yeah. Okay. This is good. Senator Cummings, go ahead, and then I'll want to finish my thought before Katie has to leave. Go ahead.
Muted. I was talking with my local peer community center, and we had just had a meeting with our local mental health agency who said 30% of their workforce is peer-to-peer. And I was asking because I know we set up respite beds. That was how we were trying to. And I was told, no, because they're part of the government, people won't go there. So I'm just wondering, how are these going to be integrated with existing these were peer support beds, crisis beds. And I know there's quite a few of them around the state. How are these totally separate, or are all of these peer support people that are presently working for mental health, will they be able to get Medicaid coverage?
These are questions that absolutely need to be answered before Medicaid gets put in place. But I'm hearing that we know there's a need out there.
Yes, we do.
It's awful. It's awful. And we also know that there are people ready to help. So if there are some funds available to expand the Alyssum Pathways type model, then maybe we'll begin to cover some of the needs that are out there. But that we're not going to be able to answer all the questions, I think, because you're raising a very good point. And how does that link in with the current set of respite beds that we have? What about Medicaid payments? And then we move into the other bill on certification. And how do we continue the current peer-to-peer that we have while also expanding to a new, a roster or a certification? We're not sure what it would be. So, and then doing an inventory across the state for what certifications are out there. So this will help not only adult peer-to-peer, but kid peer-to-peer. So there's a lot here and a lot of decision-making points. And I'm going to let you talk in just a minute, Wilda, hang on. And then, so my suggestion is that Senator Hooker, that you have a lot of questions to dive into. I will work with you on this and with Katie and with others, because we need to resolve some of the decision points and get it back into committee. Okay, is that good? And Wilda, you wanted to comment, go ahead.
Yeah, I just want to make sure you're keeping in mind that ultimately whether the services of peer support specialists will be Medicaid reimbursable is not whether it's OPR regulated, it's really whether it meets CMS regulations.
Yes, we understand.
Okay.
Yeah, we get that. We get that.
And their regulations are not like OPRs, they're very distinct. They only require a statewide certification with continuing education requirements and amendment of the state plan.
Okay.
And they leave it very much up to the state to design the certification program.
Okay, this is helpful. And I know SAMHSA has its own guidelines.
SAMHSA is
But-
irrelevant when it comes to the certification. They
Right,
just support certification,
right.
and they have created tools to help states implement the programs.
Okay. So it sounds like there is a little bit of work to do, and we don't want to leave these bills behind. We want to take a step forward. And the Department of Mental Health has said they're going to do some kind of a RFP, so some inclusion perhaps of that would be important. So working with DMH, Mad Freedom, OPR, Senator Hooker, you have and the most important person of all, besides Senator Hooker, is Katie McClin. Okay. That's the direction, Katie. I think we're going to head out to cover as respite centers in a way that makes sense stepwise, perhaps through an RFP. And then what else was I going to say? We're good. We'll chat. Katie, I don't want to hold you up because I know you need to leave. So is there anything else? Could you
Thank you. I
help us?
appreciate it. I've been listening and taking notes, and
All right.
it sounds like the next step is I will circle back with Senator Hooker, and maybe we can start putting some words on a page.
Okay. All right. Anything else, committee? Senator Hooker?
I'm just having trouble with the chats, so just ignore those that are coming.
We're going to turn that thing off. No, it's
Not
important.
seeing one.
Huh?
No, did
Oh.
she say just ignore? I thought you told me to ignore something. There's no chat.
No.
Okay.
My chats are going to different places. So
Yeah, I got that. I didn't get it. All right. Anything else, committee, on 194, 195? Okay. Wilda and Lauren, thank you very much. We're working at light speed, so warp speed it's called, I guess. So we want to, we'll be in touch. Senator Hooker and others will be in touch so we can move forward on this. Thank you for your time.
Thank you for including me, and I'm very happy to do any kind of writing if you need language.
Oh,
So
good.
don't hesitate to call on me, please.
Okay, and Lauren, you may want to stay in for the 197 discussion. We're touching on certification, but it's not going to be as robust, I think, because Katie is not here. But if you could stick around, that would be helpful.
Absolutely.
Okay, so let's just take a few minutes on 197, then, and I'll tell you where we are with that bill, then and how I've been working on that bill, and then we'll try and find some time to take a break, and then we'll be back and Ruth, you're going to be taking over whether with or without a break. So, okay. All right. So let's go to 197. There is a little draft that is on under Katie's name. If you refresh, there is also information from Holly Morehouse regarding 197, and you can read that going forward. But so as we've taken testimony and we completely understand in this committee, and then we've also taken testimony in the Education Committee, and Senator Hooker, Senator Terenzini, and I have heard that information. We know what a crisis we're at with kids in schools, where the school doesn't have the capacity to deal with some of the mental health issues that they're seeing. So, and we know also that the after-school program has been working closely with the administration through an executive order on a variety of after-school programs, not necessarily mental health issues. So as we heard that testimony, it really becomes apparent that something has to happen with kids, with schools, and to provide some support services for them, perhaps through the work that people like Holly Morehouse is doing, and then what Sunny McNaughton testified to, or Sandy Yandow. There are with different levels of certification for peer-to-peer support, understanding that there are levels for very young kids, levels for adolescents, and certain kids, not kids in school are not adults yet, but they're approaching it. But so it's more of how do we put in place programs, and the programs that are here are mostly linked in with the after school. So as you go through the bill, and I don't want to spend a lot of time on it today, and because there are reasons for that, but just that there will be grants. One of the proposals in the bill is to allow for the Department of Mental Health to provide, that are defined, grants with specific criteria, working closely with the Agency of Education to provide after school and other support services for kids who may have some needs, some mental health needs. The issue that we have bumped into as we've talked with after school, with DMH, and then with the Agency of Education, the issue that we've run into, of course, nothing new, it's funding. We have been told that ESSER funding, which is funding that goes to schools for educational use and work, we have been told that the guidelines for ESSER funding allow for the proposal that is here and drafted in the legislation, allows for the Department of Mental Health to work closely with AOE to distribute an RFP or grants, put an RFP out and then distribute grants for coordinated peer-to-peer or peer support for kids, mental health for support for kids. The Agency of Education disagrees with the interpretation that ESSER funds can be used in that way. And that's why I included the Holly Morehouse's memo where she cites the guidelines for the use of ESSER funds. I have asked, and I've been working with JFO on this as well. And so we have not gotten clarity yet on the use of ESSER funds, because it seems like a real, a win-win situation where schools are in dire need of mental health support for kids, where we have a Department of Mental Health willing to help, and funding from the federal government. So we're trying to sort out that funding piece, and that may influence the way the draft is written. The other issue is, as I indicated earlier, there was an executive order put out in the fall that would have an interagency after-school youth task force. And so we're just asking that the reports and the work that they do get reported back to the legislature, because their work will go on as long as funding's available, and that goes past this session, and I think it actually goes to the end of the next session. So having that information and coordination is helpful. As part of the bill, there as we started talking about certification with Sandy Yandow and Sonny Naughton when they were in to testify. And so the bill that we just finished talking about and asking OPR to do a kind of a look at what all the certifications are out there would help inform what's available for kids. So that's where this bill is. And Senator Cummings.
Couple questions. ESSER funds are one-time funding,
Yeah.
and this would be an ongoing program?
No, it would only exist as long as there's funding. I mean, that's the point. You know, it's at a crisis point right now. So it's like acute care, you know, and so see how there has to be some reporting back and how it's working. And
All right.
the after school program theoretically will become embedded into our culture, but we can't promise funding for all of this going forward.
The other question I have is, my local mental health agency actually runs an alternative school where kids go temporarily when they need counseling.
Yeah.
So I'm assuming some of these kids with ongoing issues have an existing relationship with a counselor. Are we setting up a second system so they'd have a second counselor after school? And you know, again, how are we going to coordinate these services? Because we've got services that are there that we're severely underfunding. And we're setting up new kind of temporary programs. So I just want to make sure that we're getting a program that will be consistent, because for a kid to start something and build a relationship and then have it end could do a lot of damage.
I don't think that's what we're talking about.
Okay.
Yeah, so you're talking about kids, the first aid for kids type program where you maybe have some activities that keep kids from mental health outbreaks or behavioral outbreaks. The issue we're facing right now with schools is an escalation in need that goes probably above and beyond what we have currently. So, but that's a good question, and we'll have to, I'm going to have to sort that one out a little bit. Go ahead, Ruth.
Just looking at the language, sort of scrolling through it for the first time. I mean, a couple comments. There are a lot of things that these programs are supposed to do for the program to get the grant, and the grants will undoubtedly be pretty small because $250,000 is not that much money. So I'm just a little concerned about the heavy requirement list for a small one-time grant. Not that I disagree with any of the things that are listed. I mean, I think they're all valuable, but, and to, my understanding as reading through this is that these would be grants to existing programs, right? So if it's like the Boys and Girls Club that already has an after-school program, they could apply for this grant to do a little bit more, or something like that.
Something like that. So the folks that we had brought in to testify who are currently doing this, and it would help to expand the availability of programs across the state, because the after-school program now is the after-school program, but this would help expand it somewhat.
What people we brought in? I don't remember.
I'm thinking about the Sandy Yandows and the Sunny Naughtons and the Lynn Codas, those folks who are
Oh, I
Lynn
didn't,
Coda talking
I
about
didn't
needs.
think they were doing after-school programming. That,
Well, they are capable, they can apply for these grants and would be willing to do that. They're not named here, but well, they are named here. For example, youth mental health first aid and other evidence-based techniques. So they're programs that have some track record.
okay. Well, there
Yeah.
are 9 things these programs would have to do to get a grant, which is, and they're
Yep.
pretty intensive. So I wonder if we want to.
I don't, yeah, no,
something like
I think it
some
looks
of
like a
these are-
lot. I think it looks like a lot, but in reality, I think that these are people, or they won't apply unless they have this capacity. They've already
This is a
done some.
lot of capacity, though. I mean, they have
Yeah.
to do training, they have to do
Mhm,
assisting families, they have to do
mhm.
partnerships with teachers and pediatricians. I mean, this is a lot to do.
Well,
for
they
a
don't
tiny
have to
little
do
grant.
all of it. They might do
It-
some of it. So
That's what it
let's-
says,
let-
the way it's drafted. That's
right,
what I'm
yeah,
concerned.
let's
So-
go through the bill when we have Katie here, and we'll fine tune it because it's still a work in progress, but the
Okay. My
questions are
other
good.
question is, there are after-school grants that were just announced that are federal grants through the Agency of Education
Mhm,
for after-school and summer programming, and that's $4.25 million.
right.
So I'm wondering, how
But they're
does
not-
this?
Yeah, so the value of this one is it's mental health. That's the value of this one. It is distinct.
I don't see that as a different, it doesn't, I mean, if these are supposed to be mental health programs after school, I'm just not sure
Go
who
to
is doing this.
so-
And
go to section 2, and it will indicate that the ESSER funding, whatever the funding is, right now it's ESSER funding,
yeah,
to the Department of Mental Health to establish and administer a 2-year program in consultation with the AOE.
no, I got that. I got
And then
that.
it,
but that-
and that programs to support the mental health and wellness needs of students, families, and staff. So they don't have to do all of that, but they will, there will be a mental health focus.
It says the department shall issue grants to after-school programs that when the applicant meets the following eligibility criteria, and then
Right.
it lists 9 things that they have to do to get a small little grant.
Yeah. Well, we
And-
can modify that. We'll have to go through it and see if that is something to be modified, but understanding that the section 2 is pretty clear about the overall intent. So,
Okay, I just don't see that this is materially different than the after-school grants that are already,
it is mental health. Those programs are not necessarily related to some mental health issues. So what I would encourage you to do is to go through the bill again, everyone. I mean, we all have to go through it again, and then look at the information that's come to us from the after school folks. And then we'll be pursuing the funding piece and related social, emotional, and mental health needs in education, because we've talked about this in there as well. Senator Cummings.
I want to hear from our local mental health agencies and hear what they're doing. I don't want to supplant their programs.
Right.
And if there's any extra money out there, they can all use it.
So this is a good comment. And as we have heard, the local schools, some of the schools have working relationships with their local mental health agencies, but that's not ubiquitous, and it isn't covering all the need that's out there. So there will be some you're right. There will be some geographic and other decision-making that has to go on. So we don't want that conflict. You're absolutely right.
Okay.
Okay, one more, because then I'm
I just wonder if this $250,000 might be better used for supporting school-based clinicians. There are some schools that have them and some schools that don't, and maybe those school-based clinicians could then do some after-school or summer work. But
that's
that
that's a
without-
possibility. I mean, the school would have to, the AOE would have to agree to that. Right now, that hasn't been the case, but we'll see what happens. So we can ask that, we'll ask that question. Senator Hooker and Senator Terenzini and I will ask that question when we get into education.
Yeah, I mean, I think that would be valuable. I mean, just I without revealing too much, I know from personal experience that these school-based clinicians are super necessary and overwhelmed. And if we could direct support directly to them rather than creating new programs, because I really feel like there's already there's funding for after school programs that just came out.
But this is different. I mean, this may be administered through that, but it is different. It is mental health. It could become segregated from, but having this accessibility will be important to schools overall and to kids. So we'll talk about it. They're good questions.
Okay.
One more.
No, not on this one. I just wondered, at some point, we're going to talk about what bills we're going to try and get out.
Yes.
Because there was an article that came out about the wait times being excessive. And you and I have a bill that's aimed at dealing with some of that. I'm just wondering if we're going to be able to get that out.
Yeah, I don't know if we're going to be able to get that out. I know the House is working on that, so it may be a time when we get something from the House that we can work on that. I do suggest that you look at which patients were referenced in the wait time process. They were patients without referral. They were patients without primary docs. They were patients who just called up to ask for specialty support. So somehow, that doesn't, some of that report is problematic, but anyway, we can talk about that. All right, committee, I need to leave and I'm going to suggest that you guys take a 6-minute break and then come back, or whatever Ruth decides. We have, and on Tuesday, Senator, thank you. I will send an email out regarding some of the bills that we're going to be looking at and trying to get out ASAP. We've been working on a lot of them, but there will be others as well. We'll do that. Lauren, thank you for being here and going through our discussion. And if you have thoughts on certification for children's support services, as I had talked with Lauren Hibbert about this, so I don't know whether she's conveyed information to you or not about whether the national certification and serves a purpose, or how does it serve a purpose in the state process.
Yes, we've discussed it, and I think we can offer some support and some thoughts on that.
Okay, that's good. All right, because this is not, again, it's not psychotherapy. It's support. It's a different level.
Right.
Okay.
Yes, we're happy to discuss and talk further with Wilda or with folks here and with Ledge Council as well.
Okay. All right. Thank you.
Thank you all.
All right, Ruth, I'm turning it over to you, and I am leaving. So
Okay.
Enjoy.
Thank you.
Thank you.
Good luck with your meeting. So we have some visitors from the Youth Tobacco Voices Exposed group that are coming at 11:10. So if we could take a break until 11:08-ish and be back so that they're not waiting for us. And all of you, if you want to send me a list of the bills that you're interested in getting to, I'm happy to try to advocate for them as well. So I'm just letting you know that. But I'll see you at